And welcome to The Word, 1490 AM. My name is Dr. Victor Carjard. I'm a chiropractic internist and board-certified clinical nutritionist with People's, Austin's favorite pharmacy. So anyway, we have a guest on the phone.
Oh, we do.
We do. Our guest today is Nurse Betty. Okay?
Oh, she's here.
Yeah, Nurse Betty is here. For those of you that have not been acquainted with Nurse Betty, she's got a very great bedside manner. She's kind of renowned for it in the Austin area. I will say that she's a little rough, but only in that sort of the drill sergeant sort of way. Let's talk briefly with Nurse Betty, who's going to tell us a little bit about, because to shift gears, as we're moving into the new season, people are kind of realizing that, okay, we're having a shift in our health care. And on the show, we want to make sure that everybody's well educated about everything that's going on. Whether you like it or not, Obamacare is here. It is changing the way that your health insurance is going to be covered, particularly if you're a small business owner and you're kind of wandering around out there trying to figure out how this is approaching you. So Nurse Betty is going to explain a little bit to us how Obamacare is affecting to us and how you should approach it, particularly if you don't know what to do with your health insurance. Nurse Betty, are you with us?
I am. I just got through finishing my Farmer's Almanac forecast for the next year.
All right.
And it's going to be hot and dry. And then I'm done. See y'all later. I'm busy. Well, how are you this morning? It is so nice to be able to visit and listen to you all this morning.
Well, howdy, Nurse Betty. How are you feeling, by the way? I heard a couple of years ago you had a little bit of heart palpitation.
You know, I did. I tell you what, I have learned so much. I am a living example that you can be really stupid about health care, but you just need to learn a little bit, and before you know it, I'm living a healthy lifestyle. I've never felt better. I tell you what, it's a wonderful thing.
All right.
Well, tell it.
I've come over from the dark side to the where the light is, and I've learned about preventive health and natural. Well, it's just wonderful. It is.
Well, I'm glad to hear that you're joining us. Come on over, Sister Betty. We're here.
It's safe over here, and I feel so much better too. Isn't that a shocker?
Well, but I know that a lot of this stuff isn't covered by the new healthcare law, and that's really kind of what I wanted to ask you about, because I got to admit I'm sitting back going, okay, I've got to carry insurance, but I'm not quite sure where I should be looking or how much it's going to cost me. And somebody said something about there being a fine if I don't manage to find it, and all of a sudden it's like one of those pop quizzes they used to give me back in grade school, and I don't know the answers, so I'm looking around trying to figure out what's going on.
Well, absolutely, it is. I mean, what we try to do is teach businesses the most simplest, easiest way to provide benefits for their employees at the most cost-effective way. And then we want to help individuals and employees be able to save money. I don't think you ought to spend any more money than you need to on health insurance. Good golly, it's expensive as enough. But yes, absolutely. Here's what's going to happen. 2014 January, every man, woman, and child must have health insurance, or else they get a spanking or something really bad. No, they do have to pay a tax if you don't have health insurance.
And how much is that tax going to be?
Well, the tax is, here's the simplest way. If you're an individual and you don't have a family that you know of, but if you're an individual, it's going to be a minimum of $95. So it's not very much. It's a small amount, or 1% of your income. So if an individual were to make $30,000 a year, then they would have to pay a tax that would be $300. So the tax beginning in 2014 is not that great. It's not going to be a huge deterrent, but it does increase as we move forward. But that's the negative side. Now the positive side is that the government, well, I don't know if this is positive. It's just the way it is.
Yeah.
So here's what most people talk about, the tax or the penalty, but what they don't talk about is that the government will actually provide subsidies for any individual that makes 400% of the poverty level or below. And a lot of people like me go, well, what in the world does that mean? Do you have that question?
We do. Please tell us.
Well, we do. Well, basically, that's an individual, or let's say that makes about $45,000 a year, is right at 400% of the poverty level. Or a family of four that makes about $92,000 a year, they're right at 400%. So any individuals or families that are in that level or below will get government subsidies.
Uh-huh. What kind of subsidies?
Well, they believe they'll average about anywhere from $4,000 to $6,000. I mean, that's a lot. Now, where that's coming from, honey, I do not know.
Oh, boy. Mm-hmm.
Yeah. Now, so let's say, for instance, that Nurse Betty, I need some health insurance.
All right.
So you might ask, well, where would one go to get the best deal? Would you ask that?
Well, Nurse Betty, if I were an individual looking for health care, where would I go to look for the best deal?
Well, I'm so glad you asked. I'd go to the farmer's market.
Exactly. That's right.
Actually, you'd be better off there. So
that's the best health insurance. Okay, sorry, go ahead.
That's the best. But anyway, what a person would do is, beginning in 2014, the best place to go if you don't have health insurance or you have an individual plan and you're looking for better options, you'll go to what's called the state exchanges. That's where you go. It's kind of like shopping for airline tickets, on Travelocity or some of these other places. You'll go online, and you can. And what they'll do is, when you go to these sites, they'll ask you, "Well, how old are you?" And they'll ask you where you live, and do you smoke? And those are the three questions they're going to ask, because gone are the days of, give me an organ recital of what's all wrong with you. They can't do that anymore, and then they cannot exclude pre-existing conditions. So that's all they're going to ask, and how much money you make.
Now let me ask a question, because I understand that our governor decided that he was not going to be participating in that, or we're not going to set up a state exchange or something. Is that
well,
true? Well,
that is absolutely correct. Victor is on top of stuff. Do not mess with him. Yes, the reality is they call them state exchanges, but about half of the states have decided that we are going to opt out of that and let the government, the federal programs, it will be the one we'll have to access here in Texas. Because what the problem is, and I could go on and on, is that it's going to cost a lot more money than the government wants to give the states to run these exchanges. So they simply said, hey, we're going to default. So you bring in your program, but it still works the same.
So this isn't the governor just trying to be a pain in the posterior about this. It's just he balanced the numbers. If I'm reading you right, you said he basically just balanced the numbers and realized it had cost us more to set it up than we were going to get balanced out by the government, the federals.
Yeah, well, that's one piece of it, plus all the work that goes into it, and we're short on time because these exchanges are supposed to be up and going October the 1st. And so about half the states have gone this way. They said, let's let the government do this first and see how this works out before we jump into it.
All right.
So we still go to a state exchange, but it's just being administered by the federal government. Is that right?
Yes.
Okay.
Yes, that is correct.
Okay.
And so right there is where most people can go now. They're obviously not set up yet, but beginning in October the 1st, they're supposed to be up and available.
Okay. Now, this is for the individual. What about for a small business owner?
Well, the exchanges are also going to be available for companies that have less than 100 employees. And so they can actually go to these exchanges too. Now, here's what the government has promised us, that these exchanges will have rates that will be competitive, if not lower, than the open market. So, plus the big news is that's the only place you can get the subsidies to buy that health insurance. And I have a live example here, if y'all would like me to go through it, of how that works.
Well, we got a few minutes. What do you got?
Okay, well, let's say that if I'm 45 years old, and then I click on there and I go through the program, and it'll show me that if I want to buy health insurance, it costs $5,609 a year, which to me that's not very affordable. That's $467 a month. Mm-hmm. Now, that's a lot of money. Mm-hmm. Now, the thing about this is the government will subsidize almost half, well, actually more than half of that, because I'm at 261% of the poverty level. So that means that instead of having to pay $467 a month, I can get health insurance for $209 a month, which makes it more affordable. And that's where a lot of people will be able to go to get subsidies to buy health insurance.
So the subsidies are actually based on the percentage of your income and how it relates to the poverty level.
Absolutely. It's on a sliding scale. The more you make, the less you get.
Interesting.
If you make too much, you don't get squat.
Okay. Huh.
And then if you make a certain level, you actually get it covered at 100% through Medicaid.
Interesting.
Anyway, but here's if anyone's interested, you can go to our website, funnyhealthcare.com, and click on the Member Education Center, and there's an actual program. You can click on the dollar bill right there, and it'll show you. You can put in how much money you make and how old you are, and it'll show you what subsidies you get. Now, this is, these are estimates; these aren't actual numbers as of yet, but it gives people an idea.
Great.
So again, funnyhealthcare.com, and that's not a comment on the integrity of the program. That's more a comment that you're trying to approach what is an extremely complicated situation with a degree of humor, so we can actually keep our head in the middle of all this.
Yeah, it's explaining this stuff is kind of like talking to, a frog that's just blinking at you the whole time, or kind of like a cow looking at a new gate. They just don't get it.
Well,
and
so
we try to make it entertaining and simple.
Yeah.
Simple
So you're
to-
about just educating people about this new healthcare system.
Yes, we want to educate them, and of course, we'll have links on our site to go to these education. Of course, we do sell health insurance.
Oh, you do?
We are an independent agent, and we help people with health insurance and life insurance. It's just life is short. And after I almost died, I said, you know what? I'm going to do this a little bit differently. God gave me a gift, and I'm going to swing it out there, sister.
Good for you.
There's a mental image.
Yes.
All right. Well, Nurse Betty, let me ask you. Okay, so they can go to the site funnyhealthcare.com, and so if they've been trying to scribble down all the information you gave us, and I will tell you, in 7 minutes, you managed to give me more information about how this system's actually going to work than I have gotten from everybody screaming back and forth at each other in the last year and a half. So
really, it's great.
I got to think I got a much clearer view of what's coming up for us, and I'm trying to figure out just how poor I am in the meantime. But yeah, I mean, healthcare costs are absolutely chewing my budget to pieces. So I'm glad we've got a little better handle on what's coming up. And again, as opposed to trying to copy all this down, if you want to go out to funnyhealthcare.com, you deal with individuals and small companies trying to get them prepared for this program coming up.
Yes.
All
And
right.
we, and to somebody, we have a exchange on there right now. People can shop and compare health insurance. So just click on there, and Aetna, Blue Cross, all those insurance. That gives them an idea kind of what that's going to look like in the future. But they can do that right now if they want to.
All right. Well,
There's just no money yet. And I don't think there's going to be any money later on. But anyway, that's okay. We just keep our head in the clouds, and we write Farmer's Almanacs, and we don't worry about that.
well, I mean, you say there's no money. It's like I looked at my budget this morning and went, yeah, there's no money. You don't get into natural medicine in the first place, and that's the one thing I'll say that this is not getting into your program, but I mean I wish the new healthcare system would better reflect the preventative medicine and natural medicine than it's been. I really wish we'd get covered more so that there are more people with access to it.
Oh, honey, yeah, okay. I'm with you. I mean, well, let me just say this, and you can cut me off anytime because it's your show. I'm just a visitor. But what's irritating is under the things that you can pay for pre-tax.
Mm-hmm.
There ain't one stinking, I hate to use the word vitamin, but natural products that you're able to run through the Section 125 and pay pre-tax.
Yeah.
Now you can, get my prescription drugs paid pre-tax, but anyway, I don't even want to get there. Don't even get me started.
Oh, trust me. I give public lectures, and people have, there are people walk out with their ears on fire sometimes when I start talking about, if there's going to be if we're going to have true choice in healthcare, there needs to be choice of providers and equity of providers, and there needs to be, hey, I set aside my HSA or whatever, and I want to be able to use that to pay for my vitamin C as well as my prescriptive drugs.
Oh, yeah. I could go on. Yes, I mean, absolutely. I mean, just like 70% of all doctors and ER visits are unnecessary and could have been handled with a phone call or an email.
Mm-hmm.
Now, think about how much money that saved right there. Plus,
Well,
not having to go to Mercury.
Well, I point out there was a study done in the was it early '90s or something. There was a health insurance company did a study, and I'm just saying this because this is the one that I'm aware of. They took the chiropractors in the area in their market, and made them the gatekeeper providers. Now they didn't change their scope of practice, and basically it's the same guys who were just dealing with neck pain and back pain and everything else. But with non-emergency room visits, I mean, they said, if you want to go to a prescribing MD within the program, you got to run through, the chiropractor first. And their rates of hospitalizations dropped by like 40%. Their rate of prescription drug usage dropped by about 50%. Their rate of ER room visits dropped by 60%. So, I mean, they cut out basically half their healthcare costs, not by changing what anybody does, but just saying, hey, go see these non-prescribing providers and see, who got some natural approaches first. Everybody seemed to be doing just fine. They cut their costs by half. Now, 80% of our healthcare budget is designed for chronic degenerative conditions. I mean, diabetes, osteoporosis, all that good stuff. Now, imagine what would happen if we managed to put chiropractors, acupuncturists, naturopaths, clinical nutritionists, PharmDs. I mean, take all, or even, hey, let's be nice to the MDs and the DOs that are actually doing preventative care, and put them on an equal footing. So you get everybody equal access. We get rid of the dearth of primary care physicians because we don't have enough to serve under the new program, and all of a sudden we're dropping our healthcare costs by half. I mean, we could afford our healthcare program just by giving more people more access. But
oh, absolutely. I mean, yeah. I mean, here's what I'm going to do right now.
I'm preaching.
Changing the term alternative medication and medicine to traditional.
I like that.
Effective. So here's what we're going to do. We're going to change it right now. It's traditional, effective, preventive medication. That's where everybody has to go first, and then we'll send them to the other medical doctors after that. What do you think?
Nurse Betty, can I send you to Washington, Nurse Betty?
Oh, I'm ready to go. Boy, I got more spit and fire than they wouldn't know what to do with me once I got up there. I would take anything off those people.
Downing care. I like this. Downing care.
All right.
That's right. I mean, when my hair is blue, but when I get up there, it turns on fire. Woo!
Yeah, that'll draw some attention to C-SPAN, won't it?
Are you going to run for president?
I would. I think I will. You never know where I'm going to end up. But
thank you, Mr. Downing.
I tell you what, it's this. Well, anyway, I know I'm a guest here. I appreciate you having me. And
all right.
I've got lots more stuff I want to do, and if you've got some folks out there that need to learn more about what's going on and might want a speaker to come when Nurse Betty is live and on stage, that's a fun experience right there.
And that's a new and interesting definition of the word fun too. Nurse Betty, it's been a pleasure to have you on again. The website is funnyhealthcare.com for anybody that wants to go out and meet Nurse Betty a little more personally and learn a little bit more about Obamacare and what's coming up in the next year for us with a tongue-in-cheek approach to being able to deal with this. Nurse Betty, thanks very much for being on.
Oh, well, thanks for having me. Y'all have a blessed day, and we'll talk again.
Thank you. You too.
Bye-bye.
All right. Bye-bye.
Bye.
Well, we've had some interesting interviews. I think that's
well, he was fun.
Yeah.
And serious and informative.
Yeah, well, like I said, I learned more in 7 minutes than I knew in the last year and a half.
No kidding.
Okay, well, I hope that little bit of clarity has brought you all a little bit of clarity as well. Remember, this is a live show. If you want to give us a call, 637-9673 is the call-in number, 637-9673. I'm Dr. Victor Karsrud, the chiropractic internist and clinical nutritionist, in today with Dr. Marianne Calvanese, naturopath. We've got to take a short break. We'll be back after this.